Hello, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is 5 things you should know about failed back surgery. Well, what is failed back surgery syndrome? When low back surgery fails, it could be due to surgery being done for the wrong reason. So it may be that surgery wasn't indicated, in the first place, but you had it and the pain continued. It could be that the right surgery was done improperly. So it could be an inadequate surgical technique and therefore the pain continues. Also, it might be that surgery was done for an appropriate reason, but not all the pain was relieved. Let's say you have surgery and 30 or 50% of the pain was relieved and you consider that a failure. That falls under the definition. Or it might be that subsequent degeneration occurs around the area. Let's say you had a fusion in the areas above and below, see increased stress, and they get degenerative and painful. Or you might have some nerve roots decompress, freed up during the surgery, and there might be scar tissue that comes in, leading to chronic pain later on from those pinching. So symptoms of failed back surgery syndrome are going to range. Usually it's some type of chronic back pain. It may be fixed in the back. It may radiate down into the buttocks or the hip. Also could include some leg pain, like I mentioned, if you have some scar tissue around one or multiple nerve roots that have been freed up. A patient may have some depression due to the chronic pain, inability to work properly, play with one's kids, or participate in social recreational activities, and it might be tough to concentrate due to the chronic pain. The first thing that you should know is that failed back surgery syndrome occurs in 20 to 40% of those who have had back surgery. A very high number is really something to keep in mind. And each additional back surgery that you have is going to have a lower success rate than the previous. It just is what it is, increasing scar tissue, tissue that just doesn't respond like it did before, more difficult surgery, higher complication rates. The statistics show that 2 years out from back surgery, 1 in 4 patients is just dissatisfied with the outcome. And I've seen that as high as 1 in 2 patients, so 50%. The second thing that you should know is initial treatment. Initial treatment should consist of over-the-counter anti-inflammatories and Tylenol. Physical therapy and chiropractic treatment can help considerably. These can help strengthen up areas around the spine or take pressure off of nerve roots and be very helpful. This may include TENS units, ultrasound, electrical stimulation, other deep tissue massage techniques. And then you have the oral or topical prescription pain medications. These can be very helpful for decreasing one's baseline level of pain. Third thing to know is what are the interventional treatment options, and this may end up making the difference between a patient being absolutely miserable and being able to get back to being, functional. First one might be trigger point injections. These are very simple injections that can help with decreased muscle spasms. They can also help with what's called myofascial pain due to the chronic failed back surgery. Medial branch or facet blocks can be extremely helpful. You can see some of those up here in the top picture. Basically, steroid and pain medicine, numbing medicine is being injected around the arthritic joints to help stop the brain from seeing pain signals. There's these tiny medial branch nerve endings, and it numbs those and helps with pain relief. Epidural injections can be very helpful, as you can see right here. If there's some scar tissue causing inflammation around multiple nerve roots, then putting the steroid medication can help with pain relief there. Radiofrequency ablation is a revolutionary treatment that can give 18 months of pain relief for facet arthritis. Let's say you have a spinal fusion, the area above or below see increased stress. They can get arthritic prematurely, and then you can have increased pain. So radiofrequency ablation can give you 12 to 18 to 24 months of pain relief. Now, if all else fails, and there's really nothing left, there's no more surgery that can be offered, all the other treatments have failed, a spinal cord stimulator can be extremely helpful. And that's actually the fourth thing to keep in mind. It's a revolutionary treatment. It's actually been shown to be good for both back and leg pain. Is it going to cure the problem? No, it's not. But it can mask pain, and it works well over 75% of the time. Prior to getting one placed, and this is kind of where it goes, right on the through the lumbar spine up into the thoracic area, it emits electrical impulses around the spinal cord. And before you have a final placement of one, you're going to have a trial placement, and you'll need a psych evaluation. Almost all insurance companies require that. The fifth thing to know is that success is achievable. Is it possible to achieve 100% pain relief in a failed back surgery syndrome? No, hardly ever. However, let's say a surgery you had got rid of 30% of your pain, and the additional non-operative treatments can get rid of another 40 to 50%. Now you're looking at really just 20%, mild to moderate pain. So comprehensive options can get patients back to work, and the top pain management clinics do offer all of these options. Arizona Pain Specialists offers the top pain clinics in Arizona. They have board-certified and award-winning pain doctors, chiropractors, physical rehab doctors, and acupuncturists. There are 5 locations valley-wide, with over 50 insurance plans being accepted, including PI, workers' compensation, PPOs, Medicare, Medicaid, and self-pay. The phone number to call for one-number scheduling is 602-507-6550. And the website to look at much more information and the treatments offered and locations is preferredpaincenter.com. Thank you very much. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.